Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in this new video in the series of Shalya Tantra-Lectures, surgery lectures for the fourth year BMS students and also for the MS who are doing the MS in Shalya Tantra Ayurveda. Okay, so we will discuss about the diseases of rectum and anal canal. Next video presented by myself, Professor Dr. Rajendra Deshpande. I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. My WhatsApp number for paid online consultation and paid online classes of Ayurveda. Mobile number is 9226810630. Request is only WhatsApp and not phone calls. So this is today's lecture is regarding the fistulas of the rectum. So let us start with the new topic, fistulas of the rectum. Can you see here rectum? This is anorectal fistulus foramen. Abscess will be first there, and then what is fistula? Fistula is a pipe. Simple thing. Fistula is a pipe, hollow pipe, and both the ends are open. When one end is open, second end closed, sinus. Only one end for the pipe, one end open for the pipe, that is sinus. Both the ends of the pipe are open. Both the ends of the pipe are open. That pipe is called as fistula. Remember, and this fistula is at the region of anorectal region. So externally there will be abscess and whole fistulous tract will be inside. Okay, next. Shalya Tantra-Lecture for the fourth year BMS and the students who are doing MS, Master of Surgery, in the subject of Shalya Tantra in Ayurveda. Okay, then CCIM syllabus, paper 2, part A, point number 13. What is the point number 13? Diseases of rectum and anal canal. My dear students, I have already uploaded nearly 2, 3, 4 videos, congenital anomalies of anorectal region. I have already uploaded hemorrhoids or piles. I have already uploaded fissure in ano or in Ayurveda parikartika. This topic is fistula in ano. In Ayurveda, it is described as bhagandar. Bhagandar, bhaga is a tear, hollow pipe. Bhagandar, okay? Fistula in ano. Let us start. Fistula is nothing but pipe. Fistula means tube, abnormal communication of unhealthy granulation tissue between anal canal or rectum with externally perianal skin. There will be first abscess, non-cleanliness, unhygienic condition, no proper shaving, no proper cleaning. Then there will be abscess, infection, and then abscess burst inside, and that becomes the hollow pipe. Okay, so you have to take good care of that. No constipation should be there. There are 3 important diseases in your medical practice regarding anorectal region. First is piles, ulcer. Second is fissure, parikartika. Third is fistula in ano, that is bhagandar. Don't forget these diseases. These are not only for exam, this is for your medical practice. Most successful you can be the practitioner if you understand this, all the 3 diseases and their management and their symptoms. Okay, let us start to study further. Next, there are 2 types of the fistula, internal fistula and external fistula types classification. Fistula in ano causes due to the persistent anal gland infection, which results in anorectal abscess, rupture, burst inside or outside, resulting in fistula. So there should be abscess. Then another cause is tuberculosis. Next, ulcerative colitis. These students don't know, they only know the abscess. But my dear students, don't forget to mention these causes of fistula in ano. See my cursor, these causes: TB, ulcerative colitis, Crohn's disease, carcinoma of rectum, cancer, and diabetes mellitus. In all 3 cases, it may be piles, it may be fissure, but if it is in the adults, if these problems are in the adults above 30, above 40, above 50, Don't forget to check fasting and post glucose blood sugar level or glycosylated hemoglobin. Your diabetes should be under control if you want to treat piles, fissure, fistula, blood sugar should be under control. Next, fistula in ano classification number 1, vargikaran. Low anal fistula, high anal fistula. What is low anal fistula? Internal opening is below the anorectal ring. Below the anorectal ring. And high anal fistula is internal opening is above the anorectal ring. Very simple to remember. See, can you see? Internal anal sphincter, external anal sphincter, high anal fistula here, high anal fistula, low anal fistula here, low anal fistula. You have to draw this figure in the examination. High level fistula, low level fistula. Then pectinate line. This is very important. Pectinate line. Anatomy. Then subcutaneous fistula. Subcutaneous fistula. High and low level fistula figure is very important. Fistula in ano. Classification number 2. Subcutaneous fistula. Below cutaneous. Below the skin. Submucosal. Below the mucosal layer. And pelvic rectal fistula. Goodsall's rule, very important. Always ask in the Viva. Always ask in the Shalya Tantra-Lecture. 1900, Goodsall's rule. If the external opening is anterior, you have to remember by heart. Path karun taka. If the external opening is anterior to the imaginary line, this is imaginary line, within 3.75 centimeter from midpoint of the anus, then the fistula runs straight directly into the anal canal. I repeat, if the external opening is anterior to an imaginary line within 3.575 centimeter from midpoint of the anus, then the fistula runs straight directly into the anal canal. Next, Goodsall's rule continued. There are 2 or 3 conditions. If the external opening is situated posterior to that imaginary line, then the tract usually will curve, and internal opening will be on the midline, posterior of the anal canal at 6 o'clock position. I am talking about Goodsall's rule. This is asked in the short answer question, SAQ, right? Very, very popular question. Goodsall's rule regarding fistula in ano. Goodsall's rule, fistula in ano, bhagandar. Okay, next. Goodsall's rule, point number 3. When the external opening is anterior but situated more than 3.75 centimeter away from the anus, then tract will be curved and end in midline posterior in the anus. So, fistula in ano. Types of the fistula. Okay, fistula in ano. Abscess. Here is abscess. Then supralevator. Then intersphincteric. Okay, ischiorectal and perianal. Goodsall's law. This figure is very, very important for the students. So they must not forget this figure regarding the Goodsall's law. Okay, which will be the straight and which will be the curved passages. Okay, this is posterior part, this is anterior part. You have to remember all the 3 points which I have already mentioned in Goodsall's law. So see this video again and again for Goodsall's law. Fistula in ano, clinical features: persistent, purulent, thick discharge. 3 words: persistent, purulent, thick discharge, which keeps the part always wet. Okay, pus discharge stained with blood. Intermittent pain with relation to discharge. Where is the maximum pain? Fissure in ano, maximum pain. Painless bleeding, piles. And bleeding plus pus, that is fistula in ano. Okay, intermittent pain. Internal opening felt as a buttonhole on digital examination. Per rectal examination is not possible in fissure. Fissure per rectal examination is very, very difficult. Okay. Then next, types of fistula: external blind fistula, internal blind fistula. External blind fistula, external opening present, but internal opening is absent. Internal blind fistula, internal opening is present, but external opening is blind or absent. Examination of fistula. How to do? Inspection of perianal region. External opening is visible. Direction of anus is palpable towards anus or rectum. Next step, you have to do the probing. Probing. It is carried out to see whether internal opening is complete or external opening is complete. Methylene blue dye is used. Treatment. In acute stage, antibiotic should be given to control the infection after culture and sensitivity test. You know that culture and sensitivity. Which specific antibiotic we should give? Warm sitz bath. This is very common for anorectal problem. Avagaha Sveda in Ayurveda. Laxative, like Abhyarishta, and NSAIDs, non-steroidal anti-inflammatory drugs. Like for example, Voveron, Combiflam are given like tablet Combiflam or Voveron. LA, long-acting 100 milligram morning, 100 milligram evening with milk or after food, because gastritis may possible. Surgical treatment, injection therapy or fistulectomy or fistulotomy. Fistulectomy or fistulotomy. Benefits of Ayurvedic Ksharsutra. Very, very famous. I have made another separate, very interesting video on only Ksharsutra. Don't forget to see this Ksharsutra video. Minimum trauma, no tissue loss, no incontinence, especially useful in high level fistula wherever there is a possibility of incontinence. You know what is incontinence? Without getting knowledge about that, I want to go to the toilet, without noticing the patient passes stool, that is called as a uncontrolled defecation. Uncontrolled, no control, no sphincteric control, that is incontinence. Cost is less of Ksharsutra. Ayurvedic medicated thread treatment, Ayurvedic cautery, Ayurvedic chemical cautery, Ayurvedic chemical cautery, Ayurvedic Ksharsutra. If you want to do from Ayurveda Academy, I have the expert of surgeons. You can definitely WhatsApp me, doctor, I am having fistula, I want to do Ksharsutra. Then WhatsApp to Professor Deshpande 922681063092268 10630. You will get the best treatment of Ksharsutra from Pune, Maharashtra State by Professor Dr. I'm not doing. Don't worry. Be happy. I have the team of doctors. They will do the marvelous treatment for you. Cost is less. It cuts and heals from the base, like the chemical cautery. Very narrow and fine scar is remain. So there is no problem of cosmetic. You know any more damage to your anorectal part. Ksharsutra for fistula, very interesting. Medicated surgical linen thread, Ksharsutra anal fistula. Okay. So benefits of Ayurvedic Ksharsutra: no bleeding or minimum bleeding occurs, low quality anesthesia is required, minimal hospital stay, recurrence rate is very, very low. So, my dear friends, this is the lecture of Shalya Tantra or Ayurvedic surgery, 4th BMS students, CCIM syllabus, paper 2, part A, point number 13, that is diseases of rectum and anal canal. I have discussed about fistula in ano, that is Bhaganda. My dear friends, I am sure Professor Deshpande's Ayurveda Academy channel is for everybody. Ayurveda for all, for the medical students, medical doctors, patients, and also for common man. So my dear friends, don't forget to share this video, like this video, and don't forget to subscribe my YouTube channel. I wish all the best and take care. Sarve Vishukana Santu, Sarve Santu Niramaya.